My name is George Mochloulis. I'm an ENT head and neck surgeon with practice at One Hatfield Hospital. Ear infection is quite common, and we always seem to have an increased number of patients that present with ear infections during the summer period. Obviously that relates to patients going on holidays, swimming in swimming pools, and also has to do with the weather, which seems to be obviously warmer in the summertime. The main thing that I always say when it comes to examining a patient is to take good history. Patients with ear infections will present with a short history of sensation of blockage in the ear associated with pain and sometimes discharge. The pain can be either manageable or in some occasions very severe, not responding to the use of normal painkillers. I always say to my colleagues, when a patient presents with acute onset of one-sided or unilateral hearing loss, this is quite a red flag and suggests that that patient needs to be referred urgently to see an ENT surgeon. Other red flags include facial nerve paralysis or any problem with the facial nerve movement. The last red flag that I will always say that needs to be referred urgently is any evidence of postauricular swelling or abscess in the area of the mastoid. We see it more commonly in children, but sometimes we can also see it in adults. In the first instance, local antibiotic treatment in the form of drops or sprays is the best way of treating ear infection. I suggest ear drops to be used for 1 to 2 weeks continuously. There's no clear evidence that, especially in adults, oral antibiotics have any role to play. I would use oral antibiotics in small babies and children, especially when there is evidence of postauricular infection. If the patient continued to suffer with symptoms despite use of ear drops after 2 weeks, the best option would be for those patients to be referred, for the patients to be seen under the microscope, the ears to be examined thoroughly, and microsuction to perform, to then examine both the ear canal and the eardrum and see if there is any evidence of perforation or infection that involves the mastoid. Patients that they have not responded to treatment can be seen in my clinic on One Hatfield. They are referred to me, but I'm also quite happy to see patients on an urgent basis, and they can either ring my secretary or One Hatfield Hospital, and I will be able to see them within 24 hours.